Have you ever been concerned about contracting HIV? Maybe not, but it affects 38,739 people in the USA, and you should be aware of what it is and how to prevent it. This data is reliable and government-sourced, and my goal is to inform you on HIV, how it develops into AIDS, and who it primarily affects. I remember learning about this disease in 7th grade, and I didn't understand it entirely or how it worked. But now that I've furthered my education, I understand the severity of it, how it works, and how to prevent it. HIV stands for Human Immune Deficiency Virus, and it affects your T cells. T cells are immune cells. HIV kills them, which weakens your immune system and makes you more prone to developing diseases. There is no cure, but they have developed antiretroviral medication that can control HIV and limit the rate of AIDS development. Is there a difference between HIV and AIDS? No, AIDS is just the most infectious stage. You have very limited T cells and you are prone to getting opportunistic infections. Opportunistic infections occur more frequently and severely in AIDS patients. They can be any disease from pneumonia to tuberculosis to cancer. AIDS patients are expected to die within 3 years of development. Antiretroviral drugs can either help or be life-saving. Who does it affect? Anyone, but it primarily affects people who practice unsafe sex and use needles. With groups, it affects African Americans, men, and homosexual men the most, but it still can affect all races, women, and children who are prone to getting it from their mother through either vaginal birth or breastfeeding. Preventing HIV isn't difficult. You just have to use contraceptives and either stay away from needles entirely or don't share them with your buddies. In conclusion, HIV is a disease that can develop into AIDS, which is a very life-threatening disease, which can affect anyone. I hope you feel educated on HIV, and I hope you know how to protect yourself. We've created a successful medication, but hopefully we can eradicate it completely. So here I have some graphs. So 38,739 people were diagnosed in 2017. 15,801 deaths were recorded in 2016. Over here we have some older data from 2010. Men with HIV, 77% were homosexual men, 12% were heterosexual men, 7% were drug users, 4% were homosexual drug users, and less than 1% were other. Women with HIV in 2010, 86% were heterosexual women, 14% were drug users, and less than 1% were other. We have more recent information from 2017, so heterosexuals and drug users with HIV. In total, there were 24 heterosexuals with HIV, 16% being women, 7% being men, and 6% being needle users. And then we have an HIV diagnosis in 2017 of majority races and genders. We have 9,807 Black male homosexuals, 7,436 Hispanic male homosexuals, 6,982 white male homosexuals, 4,008 Black female heterosexuals, 1,717 Black male heterosexuals, 1,058 Hispanic female heterosexuals, and 999 white female heterosexuals. Thank you. Did it mean it? Is it done?
I thought you were